Okay. All right, so I wanted to make sure I was not muted as well. So we are just qualifying with a quorum at this point. So I would like to put forth an amendment to the agenda. While we still have a quorum, I would like to move items 8, 9, and 10 on the agenda to follow behind item number 3, review of the minutes. I will entertain a motion to that point. I guess I can't make the motion, but I would like for that to take place so that we can vote on all actionable items.
So moved.
Seconded.
Okay. All right, it's been moved and properly seconded. We are ready for the question.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Brightway,
Yes.
Dr. Miller,
Yes.
and Dr. Orto.
Yes.
Thank you.
Very, very good. Hopefully everyone has had an opportunity to review the minutes from the September meeting. If so, I will entertain, and if there are no additions or corrections, I'll entertain a motion to accept those minutes from September 14th.
And the 21st.
And the 21st, yes, and the special meeting.
Thank you.
Thank you, Roz. Any board member that would like to
So
put
moved.
that to a motion?
Seconded.
Okay, who
Awesome.
did the first?
Nikki.
Okay, thank you. All right, Dr.
Thank
McDougall,
you. Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Brightway,
Yes.
Dr. Miller,
Yes.
Dr. Orto.
Yes.
Thank you.
All right. So the next item on the amended agenda is our committee reports. So we have our 2023 Board of Health Operating Procedures review and approval. So I will give the floor at this time to Dr. Orto, who is the chair of the Operating Procedures Committee.
Thanks so much, Dr. McDougall. So
Thank you.
the Operating Procedures Committee met in September, and we met to discuss something that had come from the state inspection of the Board of Health, and they were looking at our handbook and saw that we had something amiss. So we had to look for verbiage that included getting our Board of Health members educated on an annual basis. That just was missing. So the Operations Committee suggested that we add under number 6, under other procedural matters, that we add the verbiage that you can see below. Board of Health members will receive training on the local Board of Health authorities and responsibilities on an ongoing basis at least once a year. And so that's the verbiage that we would like to add under other procedural matters to the handbook if we can get agreement from the rest of the board.
Okay. I trust that as a motion.
Yeah, so I'm sorry. So yeah, I'm moving that we change the handbook and that we accept the Operations Committee's suggestion that we add this under number 6.
Thank you, Madam Chair. All right, very good. It's been moved and properly seconded. We're ready for the vote.
Sorry, I was on mute. Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Brightway,
Yes.
Dr. Miller,
Yes.
and Dr. Orto.
Yes.
I'm sorry, you can't vote.
I can't vote.
Yeah. Dr. Orto can vote, yes.
She made the motion, right?
Okay,
You can still vote when you make a
Oh,
motion.
Okay,
Thank you.
thank
Yes.
you.
great. All right, so old business with the review of the 2023 Board of Health Operating Procedures Handbook. Review and approval is, Dr. Orto, are you gonna?
So I think that was part and parcel
That's-
of what I just did. I think they were
Okay.
together. You know, I did the whole thing. So we had the meeting
I got
and then
you.
I brought back what we're gonna do with the handbook. So those
Okay.
are both the two things.
So that takes care of items 8 and 9.
Yep.
Is that fair? Awesome.
Yep.
Awesome. So we'll move on to the new business, our budget amendments. We have 2 budget amendments for this meeting, and I will give way to our director to present those budget amendments. Director Jenkins.
Thank you, Mr. Chair, and good evening to this illustrious board. I'll be very quick. The board is requested to approve 2 budget amendments, first of which budget amendment to recognize funds in the amount of $1,200 from the National Network of Public Health Institutes Racial Justice Competency Model Pilot Program. These funds will be used by the agency to pilot their aligning to use the pilot to align departmental policy review process to our recently developed strategic plan. The second, the board is requested to approve a budget ordinance to recognize $100,000 from NACHO, which is the National Association of County City Health Officials. Durham County Department of Public Health was awarded these funds from NACHO to collaborate with faith-based partners to identify and implement strategies to improve COVID-19 and routine vaccine confidence, education, and access. That is all, Mr. Chair.
Thank you, sir. So we have the 2 budget amendments. I will entertain a motion from the board to accept these 2 amendments.
So moved to accept the budget amendments.
Second, Vicky.
All right, it has been moved and properly seconded. If there's no unreadiness, we're ready for the vote.
Dr. McDougall,
Yay.
Dr. Wright,
Yes.
Commissioner Long,
Yes.
Dr. Braithwaite,
Yes.
Dr. Miller,
Yes.
and Dr. Orto.
Yes.
Thank you.
Awesome. We are flying through here today. So last month we had an issue, but we have taken care of this month. So we're going to keep moving. So we're going to go to the next agenda item, which is
Excuse me, Chair McDougall,
I'm
we
sorry.
need one more vote, the policies.
one more vote.
The policies. We need to vote on the policies,
Okay.
the 8 policies.
Okay, that was at the, is that?
That's in old business.
Okay. Let me pull that up. I'm sorry. Forgive me. Okay, so the policies here. So the special notes, Roz, is that the
Yes, sir. Those are
Operating-
the changes that were made to the policies.
okay?
By our deputy.
Okay, so hopefully we've all had an opportunity to look over those as well. I don't know if our director or our attorney Andrews might want to discuss these. Hopefully everybody's had a chance to look over these things, the removal of the CD as an electronically accessible format from line 5, so
Chairman,
on and so forth.
Chairman,
Yes,
just
sir.
once you have the director, at least,
Go over those. Yeah,
go a little bit, because people, you have to go in and out of screens, and some people on portable devices. It's not that easy. So
sure.
while they all execute that that exercise, Director Jenkins can just surprise us of what's in the amendments.
Absolutely. Director Jenkins, are you
These two.
willing to do that for us?
I will defer to Deputy Public Health Director Christian Patterson. She is responsible for the accreditation items that needed to be updated. She's on the
Okay.
call. I'm hopeful that she can hear and understand what we're asking her to do. I do apologize for all the mix-up.
And in lieu of that, the chair can read the amendments, at least so we've read them into the record.
Okay. So I'm looking at my email while we wait. So the starting with the special notes, the Board of Health operating, well, we've already taken care of that. So the Board of Health policy review approval. Item number 5, the following changes were made to the Board of Health policies. A, to changes to policy Board of Health -007 public participation policy, removed CD as an electronically accessible format from line 5 of that policy. Item B, changes to policy BOH-006, adopting, amending, or repealing BOH rules. Removed 1 from the reference to 130A-247, 1 line number 3 under purpose, modifications of the statutes, including multiple establishment types found under 130A-247, not just those under 1. Item C, changes to policy HD-20, employee recruitment, retention, and professional development policy. Under employee recruitment, added to H, quote, including dental and vision, added, quote, weight management programs, etc., end quote. To J, added K through R. The next item under Durham County Department of Public Health training spreadsheet, separated number 3 from number 2, and then removed at the verbiage at least from number 2. Replaced, quote, for both new and continuing employees, end quote, with, quote, are included, end quote. The next item under employee training log, modified number 1 through 5, number 5, and added number 6. And the final item is under employee training acknowledgement form, added, quote, in person, end quote, to number 1 and added number 6. All right, any questions?
Mr. Chair, you just knocked it out for us, and we are so appreciative. Sorry for the
Yes,
snap.
indeed. Yes, indeed. So I will entertain a motion to accept those changes. from the
Motion
board.
to accept changes.
Second.
Second.
All right, it has been moved and properly seconded. If there's no unreadiness, we are ready to vote.
Dr. McDougall,
Yay.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Braithwaite,
Yes.
Dr. Miller,
Yes.
and Dr. Orto,
Yes.
and Dr. Glover.
Yes.
Thank you.
All right. So we are back to the top of the agenda. We have, we're now at item number 4, with public comments. Ms. McLean, do we have any public comments that have been entered in
No, sir.
for today? Very good. Okay. So we will turn I will turn the agenda over to our director for any staff or program recognitions at this time.
Thank you, Mr. Chair. Just recognizing the entire staff. On yesterday, we had our very first all-staff on-site meeting for Staff Development Day. And it was a great time. A lot of nervous people, so we made it a massed event out of abundance of caution. But big shout out to our Workforce Development Committee under the leadership of co-chairs Jim Harris and Anne Marie Burke. They did a mighty fine job, and just want to really lift them up and just say how grateful we are for their hard work.
Awesome. Thank you, Director Jenkins. All right. Do we have any other program or staff recognitions before we move to the next agenda item? All right. Seeing none, we're going to move on to item number 6, administrative reports and presentations. We have Savannah, I hope I don't mispronounce it, Carrico, on the Zoom call to present our Youth Risk Behavior Survey presentation.
Yeah, thank you everyone for being here tonight. I'm very excited to be here. Let me share my screen here real quick. All right. So, yes, my name is Savannah Carrico. I'm the public health epidemiologist with Durham County Public Health. I've been in this position about 2 years now, and I'm here to talk about the 2021 Youth Risk Behavior Survey results. So this was actually conducted in the fall of 2021. It's a national survey that's done every 2 years. So it was done in 2019, 2021, and the 2023 Youth Risk Behavior Survey was administered last spring. And we were hoping to get the results next year. So the CDC actually designs the survey. It accounts for about 2/3 of the questions that are on there, which is mandatory, while state and local entities do have a chance to enter a new set of questions of about 1/3 of the questions on the survey. Durham County is actually an oversampled county, which means that most of the middle schools and high schools were able to participate. The YRBS covers a wide variety of topics, which I'll get to here in a second. And then the delay in the data is actually due to the process that it follows. So because it's a CDC designed survey, the analysis goes to CDC. So once the survey has been administered, CDC gets the results. They do their own analysis and their own weighting of the data. It then goes to North Carolina State, or the Division of Public Health, and they analyze it for their annual report. And then finally, the district level data comes to the counties. So here are the topics that are covered in the Youth Risk Behavior Survey. Those in black are topics that have traditionally appeared in the previous reports. Topics in blue are new sections that we've added this year, including a section on LGBTQ+ mental health, disability, COVID-19, and school support. So as I mentioned, Durham County is oversampled. So we were able to get all middle schools participated and 9 out of the 10 eligible high schools participating. Like I said, it was administered in the fall electronically to randomly selected second period classes. So some quick demographics. The data is weighted, so therefore it is very representative of the Durham County middle and high school population. The middle school sample was equally divided into thirds for 6th, 7th, and 8th graders, while the high school sample was skewed towards 9th graders, which represented about 1/3 of all students that participated in the survey, while 12th graders were underrepresented, accounting for less than 1/5 of the students. So I'm going to touch briefly here on some racial inequities that are evident in this survey and in our educational system. I highly encourage you to read the full report that's available on the Partnership for Healthy Durham's website. website. It goes way more into detail. It's much more expansive than what I'm able to present to you tonight. So I highly encourage you to check that out. But here are some key points I just wanted to mention. The student-teacher relationship is extremely important. However, in education, we do see that Black or African American students taught by non-Hispanic white teachers are more likely to receive a worse behavioral assessment than white students and are suspended 3 times as often. For mental health, we know that racism at an early age leads to toxic stress throughout a person of color's lifetime. This was exacerbated in 2020 with the killings of George Floyd and Ahmaud Arbery, which increased racism towards Black or African Americans. And of course, the COVID-19 pandemic that began in March 2020 increased racism towards Asians. In this survey, a question was asked about discrimination, and 1 in 5 middle schoolers and 1 in 4 high schoolers felt they were treated badly or unfairly because of their race or ethnicity, either sometimes, most of the time, or always. I'm going to begin discussing the topics that are covered in this report. So first up is bullying. So you can see that bullying is much more prevalent in middle schoolers in blue than it is in high schoolers in green. We actually do, studies have shown that this is the case, that often bullying begins in elementary school, peaks in middle school, and slowly declines in high school. And one thing I wanted to point out that I thought was interesting was since 2017, the cyberbullying among middle schoolers has increased, while among high schoolers, it's actually decreased. And cyberbullying was experienced more by females in 2021, and twice the amount of middle school students reported being bullied for their sexuality compared to high school students. Moving on to our news section for disability, there were 3 questions that were asked, and 16.4% of students reported having trouble learning or remembering, whereas 9%, almost 10% of students each believed they were limited due to a disability or believed they were living with a disability. A similar percentage of students reported having trouble learning. And high school students were more likely to report facing limitations due to their disability than middle schoolers. So mental health, I know, is a big topic right now, and we're fortunate that this youth risk behavior survey was conducted post-March 2020. This allows us to take a look at the well-being and health of students pre-pandemic and post-pandemic. So this has been very insightful, however devastating to see the effects that the pandemic has had on the mental well-being of students. So 1 in 3 middle schoolers and 2 in 5 high schoolers experience symptoms of depression as defined by the American Psychiatric Association, which you can see on the left here in this chart. Most students reported sometimes, most of the time, or always having bad days in the past 30 days. More females than males reported having bad days most of the time or always in high school students. And a study found that girls are actually more likely to internalize their distress, and they feel pressure from social media from among their peers to have a picture perfect life, which is, a detriment to their mental health. Just so you know, I'm going to be discussing suicidal ideation. If you need to mute me or step away for a little bit, I'll try to wrap this up in under a minute. So I just wanted to let you know that that is the topic of this slide. It is pretty devastating among both middle schoolers and high schoolers. Black or African American students make up almost 50% of the students that have suicidal ideation. And this has really increased since 2019. So again, most likely due to the pandemic, as well as the increased racism that these students are exposed to, as well as adverse childhood events contribute to suicidal ideation among children of color, which are already overrepresented in this population due to systemic racism. So the LGBTQ plus mental health section was added this year. So students that identify as part of the LGBTQ plus community have limited, if any, access to mental care, let alone finding a provider that is culturally competent, one that they feel safe discussing their sexuality with, without fear of being discriminated against or having their treatment biased. One thing I wanted to point out was bisexual students were more likely to report suicidal ideation than their gay or lesbian peers. This is likely due to the barrage of biphobia, monosexism, and bi-erasure of bisexual culture that the students and LGBTQ plus populations endure. I know I'm going really fast through these, so if you have any questions, please feel free to come off mute and ask me. I'm going to try and make sure I leave about 5 minutes for questions at the end. So I'm just going to briefly touch on nutrition. So this question was asked of both high schoolers and middle schoolers. How many days in the past 7 days did you eat breakfast? And you can see that among high schoolers, it was about the same percentage, pretty close. For high schoolers that ate every day versus high schoolers that ate 0 out of the 7 days for breakfast. Children of color are often more food insecure than their white peers. However, Durham Public Schools now offers free breakfast every morning before classes start. For personal health, I just wanted to include something on sleep. So the CDC recommends that students get 8 to 10 hours of sleep each night. And for middle schoolers, you can see that trend is a little more closely followed, with the blue being slightly skewed towards the right, indicating they receive more sleep, whereas high schoolers are slightly skewed to the left, indicating they get less than the recommended number of hours of sleep each night. So personal safety, I actually have 2 slides on this. I really wanted to include it. So this slide talks about students that skipped school because they felt they would be unsafe at school or either going to or from school. You can see the fear of being unsafe is much more prevalent among high schoolers than middle schoolers. And the top reasons that students miss school is because of school shootings, bullying, or anxiety. I thought this question was particularly important to include this year, given the current climate, with recent studies coming out that firearms are the leading cause of death for children and adolescents. So I thought this statistic here was pretty staggering. So a little over 1 in 10 middle schoolers and high schoolers reported being able to get and be ready to fire a gun in less than 10 minutes. And in Durham County, we know that about 1 in 3 households owns a firearm. So I wanted to just point this resource out for anyone that's curious. Free gun locks are available from the gun safety team at Durham County by calling this number here. I've listed it in this slide for you. But you can see that it takes most students, less than an hour to be ready to get and fire a gun. So moving on from that, physical activity is next. So CDC recommends that children get at least 60 minutes of physical activity each day. Black or African American students were nearly 3 times as likely to play on a sports team than white students. And you can see that Black students were also more likely to meet that requirement of 60 minutes per day than their white peers. School support was a new section we added this year. As I mentioned earlier, the student-teacher relationship is fundamental to a student feeling belonged at school. And in a national survey, I found 94% of teachers reported agreeing that students felt comfortable asking for help, while 88% of students agreed. So I think that's pretty good there. Sexual behavior, I wanted to bring up this question that was asked regarding condom use during the last time that sexual intercourse was had. Sexual intercourse is actually very uncommon among middle schoolers, according to this survey, but it is more present among 8th graders and in males. 6th graders reported being less likely to receive sexual education regarding abstinence. And among high schoolers that are sexually active, 11th and 12th graders were more likely to use a condom during their last sexual intercourse experience. Excuse me. So I have two sides on substance use, one on alcohol and one focusing on other substances. So almost 10% of high schoolers reported drinking 1 or 2 days out of the past 30. And high schoolers that tried alcohol before 17, females were more likely to drink. And females were actually also more likely to drink in the past 30 days. And peer pressure, wanting to feel grown up, and exposure, such as seeing families drink, all increase a child's likelihood of drinking at a young age. So the graph here on the left discusses current marijuana use. 6.5% of students reported using it 1 to 2 times in the last 30 days. 8th graders are 3 times as likely to use marijuana than 6th graders. The use of harder drugs is fortunately very uncommon among Durham County adolescents, and I'm referring to meth, heroin, and cocaine, while 8.7% of middle schoolers and 14.3% of high schoolers reported misusing prescription drugs. Tobacco use, this is something that we see with every youth risk behavior report. I am happy to announce that less than 3% of both high schoolers and middle schoolers use cigarettes, which is a decrease over the years. However, electronic vape products are more and more common, and they're more available and marketed towards youth. 15.7% of high schoolers and nearly 8% of middle schoolers reported using an electronic vapor product in the last 30 days. And on the left, you can see that females are more likely than males to have ever used an electronic vapor product. And this can be due to the marketing. Often females are attracted to vaping because it is linked to curbing appetite. And lastly, I'll go over COVID-19. There was only one question this year on the Youth Risk Behavior Survey regarding COVID-19, and that was, do you agree or disagree that that during doing schoolwork was more difficult during the COVID-19 pandemic than before the pandemic started? Overwhelmingly, students agreed or strongly agreed. And this also was evidenced by lower income families being at greater risk of children falling behind due to limited resources such as access to broadband internet and experiencing high levels of stress, especially among children of color. Okay, I know, again, I went over that very, very quickly, but I think we do have some time for questions if anyone has any. And thank you so much for allowing me to be here and speak on this.
Well, thank you for being here, Savannah. I had a question, and I think it was with slide number 16, and I think you kind of touched on it, but I wanted to just get clarification. Let me get to that slide. So with physical activity, I see the graph, but the bullet points, again, you spoke about African Americans being more likely, 3 times more likely to play on athletic teams than white students. But then the second bullet says white students were over 2 times as likely to exercise 60 minutes per day in the past week. Compared to what? Is that compared to the last survey or compared to Hispanic students?
Yes, excuse me. That should have said the last survey.
Gotcha. Okay. No problem. I just wanted to get that clear. Thank you. So
Yeah,
go ahead.
Thank you, Dr. McDougall. This is Gene Ray. Just a quick comment. I just frankly think it's somewhat remarkable that 2.4% number around cigarette smoking and exposure just seems just like a remarkable number compared to in the past. Can you comment at all in your experience of are we continuing to sort of trend very positively as it relates to cigarette smoking, and any specific factors that may be related to that decrease?
Yeah, I think there's a couple things that contribute, and I can provide a list of more resources and research after this if you would like. But cigarette use has been decreasing within the community as a whole, and we can see among high schoolers and middle schoolers as well. I think that part of that is due to the increase in the availability and popularity of electronic vapor products. Given that they come in flavors, they're often bright colors, and oftentimes these shops, the tobacco and vape shops, are more prevalent in lower income areas, thus exposing more children of color to them.
Got it. Got it. So they're not necessarily avoiding tobacco. They're just switching product of choice
Correct.
away from cigarettes. Okay. All right. Okay. Thank you very much. Appreciate it.
So, and a follow-up to that, this is Dr. McDougall, is compared to the last year's study, are we seeing, so the rate at which the students are using the vape products, the electronic vape products, is that comparable to cigarette usage in the past, or is it higher?
That's a great question. I will look into that and I can provide you an answer.
Okay, yeah, sure, no problem. Thank you for checking into that.
Yeah, just gonna write that down.
Dr. McDougall, Commissioner Alam had her hand up.
Oh, I'm sorry, I didn't see that. Go ahead, Commissioner Alam.
Thank you, Dr. Jenkins and Dr. McDougall. Thank you so much, Savannah, for this presentation. It's really great to have, like, for our board is constantly talking about, you know, what can we do to have a greater impact on our youth and starting young with different interventions and program creations. I know you mentioned that most of the questions are formed by the CDC, or all of the questions are formed by the CDC, right? Does the county have any discretion of like including our own questions or suggesting questions to the CDC?
Yes, we were among a large group of organizations that were invited to contribute to changing some questions. That was for the 2023 Youth Risk Behavior Survey, and I believe that was discussed in early 2021. So it is pretty far in advance that these questions have to be finalized. But yes, we were invited among others to contribute to those other questions.
Because I'm glad there's questions about like ethnicity and diversity. I'm wondering, like, especially now, unfortunately, we've been seeing, like, you know, a rise in anti-Semitism and Islamophobia, like factoring in also how does the impact of religious discrimination impact students, and being able to track that at the county level. Because I don't think there's really, I want to say, any agency that's tracking that at a young age. So that would be really valuable if there's a way for us to get that into the CDC to be able to include. I'd really appreciate that. And then my other question was, is there any way, like, to correlate this data with, like, looking at, I don't know, I have it in my brain, it may not make sense trying to say it out loud, but like looking at, okay, this school has guidance counselors X number of days a week versus this school doesn't have guidance counselors as many times, and correlating the data from those schools to see, we may not be a direct link to how the students respond to the survey, but seeing if we can build a correlation that can help us also in the conversations when we go to the state legislature of, like, this is why it's important for us to have better funding in our schools for counselors, nurses, and these types of programming.
Yeah, I would be fascinated with that as well. I'm not sure if I have access to the data about school counselors and their contribution and how much they're able to help. But I would also be very interested in those results as well. I will follow up on that.
Thank you again, Savannah.
All right, do we have any other questions? All right, well, again, Savannah, we thank you for that presentation. Great information. There's work to be done, obviously, with our youth, but great information. And now we have some things that we can work toward in improving the health for our young people. So we'll move on to the next agenda item, which is our health vacancy reports for October. So we'll give the floor to Director Jenkins at this time to quickly review that.
I'll be real brief, Mr. Chair. We were holding steady in the month of October, had several promotions, which in a sense created some vacancies. However, we're still subject to the shortage, nationwide nursing shortage. However, I think you will be pleased for the next report, because we've made significant strides when it comes to school health nurses and just filling vacancies. Not to say that we haven't received our fair share of resignations and showing individuals the door, but we continue to have a nice delicate balance where the gains are starting to outweigh the losses.
Awesome. Very good. All right. Do we have any other questions or comments regarding the vacancy report? All right. If there are none, we'll move on to the NOV report. I don't know. I didn't check to see, is Mr. Eaton or Morris on the call?
Mr. Chris Schultz is on, and he has indicated that there's not really been much movement. It's still good,
Not movement.
but
Okay.
I certainly let him speak for himself.
Yeah, Chair McDougall, I would like to just mention that we'll take this kind of month every day. We were able to only add one new NOV and move 3 down to the compliant list. So that's always a good month.
Awesome.
Yeah.
Yeah. Very good. Very good. Thank you.
Thank you.
That is awesome. Okay. Yeah, we'll take that, and if we can get better, we'll take that too. But this is good. Okay, so we'll move on to the health director's report.
I always struggle with this health director report, Chair McDougall and Board of Health, because there's so much good work going on, and I don't want to leave out anyone, but I certainly want to lift up what you read about the chronic care initiative, really partnering with our health education division to really put a strong emphasis on our Spanish speaking population. That was a great program, had some nice pictures of those graduates of the program for your consideration. So definitely want to lift up that collaboration. And then, of course, something that's near and dear to the chair's heart is our dental division. Lots of remodeling going on. That is a very, very busy clinic. We certainly want to make sure that it's kid friendly. I went down there to see the improvements myself, and I can't wait for everything to just really come together. But also, which is not added to the report, is that our dental van is up and running. Big shout out to Marcia Richardson and her team for making sure that the technology and connectivity was there. Had a little bit of issue with that, but we're good to go. So we are now out and about in the community, making sure that dental care is being taken care of. And then, of course, I'll move to something that public health is really, you're going to hear about in the near future, that public health is certainly taking a strong stance on, ladies and gentlemen. That's harm reduction, substance use disorders. Again, I was partnering with Durham Housing Authority, really emphasizing how seniors are really falling victim to this epidemic and just doing something about it. Again, just kind of giving you a sneak peek. Durham County Department of Public Health is going to be leading the way and leading the charge when it comes to that. So more information for your consideration to come. But, again, we want to make sure that we can spread our efforts across the entire county's enterprise. But this work that was highlighted is phenomenal, and it speaks to our partnerships with our community. But last but not least, something that's a strong charge of the Board of County Commissioners, which our Board of County Commissioner Rep, Commissioner Long can attest to, is maternal child health. Our ICO for MCH program really partners strongly with our community-based organization. That's MAME, Breastfeed Durham, and many others, just to really promote National Breastfeeding Month. And there were a lot of activities that were highlighted. This is just a sliver, and more information is going to come. We are very committed to making sure that we move the needle, not only with maternal child health, but also with infant mortality as well. That is all I have to highlight, Mr. Chair.
Awesome. Yeah, I was drawn to the partnership with DHA and the looking in the substance use disorders with the seniors in our county. I'm wondering if I'm sure there are lots of different data that is being collected now as we're starting these engagements, and down the road we'll be able to look and see if there are any changes any improvements really that have taken place as a result of these roundtables that were table talks, I think, and lunches. It sounds like you gotta feed them to keep them there. I
Bring it to the table somehow.
Yeah. I kind of chuckled when I saw that they said, and they were forthright saying, the residents saying, they would walk out if they weren't able to participate. And so yeah, I appreciate the effort that the health department is making to, like you said, meet them where they are, and so that we can have a positive end once it's all said and done. So yeah, great stuff that's going on in the health department. So we thank you, Director Jenkins, and your staff for all the amazing work that you're doing for Durham County.
Indeed, forever grateful for this board support.
Absolutely. All right. Well, I think we are at the tail end of our meeting here. Do we have any other? We're at item number 11, informal discussion. And any informal discussion that anyone on the board or in the gallery would like to put forth? All right. Well, hearing nothing, I will entertain a motion to adjourn. Oh, one more thing.
Before you go, Mr. Chair, just know that next meeting you have a couple of to-dos, 3 to be exact. You will hear from our finance administrator to provide you with a first quarter budget update. You will also hear from our illustrious medical director with the 2023 communicable disease report. And you will also hear from our population health division director or a member of her team with our state of the county health report. So we look forward to provide those to you in the month of November.
All right, very good. Is there any items, any reports that any of our board members would like to see or hear at the November meeting, in addition to those 3 that Director Jenkins pointed out to us? Okay. Well,
I have one quick.
Go ahead.
Dr. Jenkins,
Commissioner
the
Alam.
Saturday is the last Saturday for the lead testing, right? Or is it? Or
Actually, Commissioner Lum, it is today.
okay.
We were doing it 2 to 3 days a week, and unfortunately, we had to make the executive decision to discontinue it because from several weeks that have passed, we've only had 4 people to show up.
Oh, okay. That makes complete sense. Just wanted to make sure so we're not still advertising it.
Absolutely. We did put out a press release to that effect, but I appreciate you bringing that up.
Thank you. Appreciate it.
Awesome. All right. Any other questions, comments? All right. I will entertain a motion to adjourn.
So moved.
Seconded.
All right. It has been moved and properly seconded. If there's no unreadiness, we will call the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
and Dr. Glover.
Yes.
Thank you.
Thank you, everyone. Quick meeting today. Well, 50 minutes, not so quick, but a good meeting. A lot of things that we covered. So we appreciate you all being on board here today so we could get through all the things that we needed to take care of. Thank you so much. We'll see you.